Hello everyone, my name is Debbie DiMartini and it's time for Let's Talk Shop. I'm a certified clinical thermographer at Thermal Body Scan in Santa Cruz, and today on my blog I'm going to be answering a question. Tanya from Aptos sent in a question. Tanya is wondering if her thermography replaces her annual screening mammogram. And the answer to that question is a bit complicated. First and foremost, no, it does not. The reason for that is these are two different types of tests. A mammogram or an ultrasound, MRI, those are all tests of anatomy. So those are looking into the body to locate and measure structure. So it's looking for the lump or the tumor itself. Thermography is a test of physiological function and metabolic process. What we're looking for with thermography is the developing blood supply. So that's any kind of activity associated with a tumor that's growing in your body. Now, because we're looking for the activity of the tumor, not the tumor itself, with thermography, we can see the developing blood supply up to 8 to 10 years earlier than your mammogram. So in a lot of cases, we will see abnormalities on your thermal image that won't be detected yet on your mammogram because it's too early, the lump is too small. Now, one of the advantages of having the thermography report is that if something comes back abnormal and then you're referred to go get an anatomical test like an ultrasound or MRI, it helps, or mammogram for that matter, it helps the radiologist that is interpreting your imaging to kind of say, like, look right here, so that they're not just looking at the whole breast and unable to see things. So it kind of gives them a guide, if you will, as to what area they need to be paying particularly close attention to. So the two complement each other. Now, I know that there's a lot of question and debate about the mammography screening guidelines. Several years ago, the U.S. Preventative Services Task Force did change the guidelines to women over 50 being screened every other year. The reason that that has changed is they're kind of backpedaling a little bit because we do see the harmful effects of radiation that people are exposed to year after year. And at some point you have to look at what the risk is versus what the benefit is. So under normal circumstances, what I tell people like Tanya is that if you're having thermal imaging done and your thermal images are coming back normal, then obviously you're going to want to consult your physician to proceed with your annual screening mammograms, or maybe you come up with an option every other year. I personally don't do mammograms. I do ultrasound because there is no radiation, which is safer for you. So that's also an option that you sometimes have to push for a little bit. But if you do and your doctor is receptive, which they should be, you can request other type of tests, and that's certainly acceptable. I will state that there are a lot of studies that show that thermal imaging, the #1 risk marker for developing breast cancer in the future is an abnormal thermal image. So again, take that into consideration when you're trying to decide. But the two are what we call adjunctive tests. You want to use the physiological tests along with the anatomical test for best results. And if we do that, we can detect up to 97% of breast cancers. So keep that in mind. Hope this helps. And keep the questions coming. I love answering them. They're really good questions. And we'll talk some more next week. Thanks for joining me for Let's Talk Shop. Thermal Body Scan Santa Cruz conducts digital infrared thermal imaging, and we are located at the Galleria in downtown Santa Cruz. Thank you so much.